From a financial point of view, it's a very good question, and a question that a lot of people are asking. How can you finance this seemingly enormous ambition of universal health coverage? And this is the whole issue of where to find the fiscal space to finance universal health coverage. It is possible. It will have to be a combination of increasing domestic resource mobilization through various mechanisms, such as innovative financing mechanisms, but also ensuring that countries increase the allocation of budget to health. So that's one way of increasing the fiscal space. You have also to make sure that countries try to spend their money better, improve the technical efficiency, get more health for the money. And it is a big area as well. Many countries have a lot of space to try to improve the way in which they spend their resources. You could also borrow, but I know that's not very popular. And undoubtedly, a lot of countries will still need aid to help them achieve universal health coverage, particularly low-income countries and low-middle-income countries. The middle-income countries, they can probably do it on their own. But the poorest countries will continue to need help. And they will need that help whilst they build their own domestic resource mobilization approaches. We can't expect countries like DRC or like Somalia, which are very fragile, to all of a sudden provide the resources that they need to achieve that ambition. It depends on the situation of the country. Some countries are very good, have very much improved the way in which they collect their revenues. They make sure that they have as large a base upon which to collect those revenues from. They make sure that they implement measures that are equitable. So some countries are really good at the revenue collection, but not so good at pooling all of those resources together to ensure that there is cross-subsidization. Some countries are very good at collection and pooling, but actually do nothing around the strategic purchasing. And they just focus on giving line item budgets, for example, or they just give global budgets to hospitals. So it's very context specific, I'm afraid. But I would say that if I had to give a general answer, by definition, you have to start in where you need money. So at the revenue collection, you need that money to be able to pool it in any way and to be able to purchase resources in any way. So I would say that, of course, the priority overall would be on the collection of revenue. So, for example, Swaziland supposedly spends a lot of money on health. So the issue doesn't seem to be so much around the revenue collection. Yet the health outcomes are not so good relative to how much money they spend. And when you look at the purchasing that they do, it is not strategic in any way. It is completely passive. So it's really about working with the country in improving the purchasing that they implement. So their priority actually is strategic purchasing. Other countries, Sierra Leone does not collect many revenues from its population, doesn't have a functioning health insurance system, has enormous burden on households through user fees. That country really needs to work on how we can raise revenue in a way that is that makes sense from an equity perspective and an efficiency perspective. So I would say that the focus in Sierra Leone would need to be revenue collection. So it very much depends on countries. I think it is essential for a Ministry of Health to engage in dialogue with ministries of finance in particular. And our experience is that whenever we go to a Ministry of Finance representing a Ministry of Health, the Ministry of Finance will say, "Ha, there you go, you want more money." So yes, of course, a Ministry of Health should ask for more money when it needs more money. But it should probably be the third point it makes to a Ministry of Finance. I think the third point that a Ministry of Health can make to convince a Ministry of Finance to invest in health is that health is source of economic growth. Investing in health will translate in economic growth. A lot of ministries of finance say that, that health is not a productive sector and hence it's not worth investing in it really. Well, actually, if you don't have a healthy population to work, you will have a very heavy burden on your economy at large. So that's a first point that a Ministry of Health could bring to a Ministry of Finance, and demonstrating it, and there is a lot of literature on that. The second point is to say, from a Ministry of Health perspective, I know I can spend my money better. I know that I can bring you greater value for money. I know that I can bring better health outcomes through the resources that I have. And I will show you how. And a lot of Ministry of Health, what they do is they focus on health workers and on drugs in particular. And they investigate where they could make efficiency gains, technical efficiency gains, on those particular aspects. So for example, purchasing more generic drugs. So for the same amount of money, you just get more drugs. So this is a way of improving technical efficiency. And it is something that Ministries of Finance really appreciate, to see that a Ministry of Health is working towards better value for money. And I think these would be the main points. And the third point would be eventually to say, by the way, I still need more money. So it's very much a policy dialogue between Ministry of Health and Ministry of Finance. But I wouldn't start with I need more money, I would finish with that.